with acne patients, it's widespread problems. Okay, often these patients have been to their family GP, they've been given a script for antibiotics, they've tried a heap of over-the-counter preparations that have not given them much effect. They're starting to get really desperate because they want to see improvements fast. And so a lot of our patients that come to us are word of mouth because they've seen other people who've improved with their acne. So my approach to acne is always look at it medically. Okay, we have to take an appropriate history from the patient, find out what's happening in their diet, their exercise, what's going on with the products they're using at home, what else have they tried, how many antibiotics have they been on, have they had any ablative treatments before. Often these patients have got such a mess of products in their cupboard that need to be really pared back to quite a simple level. And it's about restoring and replenishing the skin health and taking attention to their mental health and their social issues that may be going on associated with acne, what occupation they're likely to take up in their life that may be dependent on what scarring they're going to get, and trying to improve these kids' self-esteem, because acne, as you know, is quite a desperate condition that can create quite a lot of mental health and depression. So it's important to acknowledge that patient in front of you as, even though to you it may seem like only a mild case of acne, to the patient it could be quite moderate or severe, and could be something that, depending on what their skin type is, can create quite significant scarring and pigmentation problems down the track. So it's important to get onto it early. So our approach at our skin repair clinic is basically to have an acne consult with the patient first, work out what's going on in their life and what the history is and what products they've used, and then we usually enrol them in a course of, depending on what severity of acne they've got. Antibiotics will usually be used orally. We'd enlist them in a course of phototherapy treatments, which usually are around 6 to 8 week treatments twice a week. So it means compliance on the patient's part, and the topical retinoids and cosmeceuticals, which we offer at our practice as well. I find that most patients, if we can reassure them that it's going to take 6 to 8 weeks to see a response, not to expect miracles soon, you'll have compliant patients who are willing to stick with the program and good results. We take the before and after shots at that point, and most of our patients are already on the improvement. And I'd say that with that approach in a holistic manner with all the modalities we offer, and then looking at what's happened at the end as far as their scarring goes, we can then move on to offering microneedling, ablative treatments, platelet-rich plasma, and dermapen sort of treatments to help the scarring. Once we've got the active acne under control, it's all about what can we do to help the pigmentation and scarring that's there at the end. And we have a lot of happy patients at the end, and very few that we end up having to refer to the dermatologist.